Good afternoon. Good afternoon. Thank you to everyone who is tuning in this afternoon. Happy Wednesday. And thank you for continuing to tune in to the press conferences. Next week, this press conference will happen on Monday. So instead of next Wednesday at 1, it'll be next Monday at 1. And then the following week, back to the usual time slot. As always, please continue to keep yourselves informed. If you don't have time or you're not able to tune in Wednesdays at 1 or Monday at 1, I would strongly encourage you to get the email. The governor's office sends out an email every single day, up-to-date information. You can, if you haven't signed up for an email yet, governor.ri.gov. Take a minute and do that today, and I think you'll find it keeps you up to date. So today we'll begin, as we always do, having a look at the data, and I'd ask you to please put the slide up. Today, we're reporting that yesterday we had an additional 79 new cases, and very sadly, another 3 deaths. Continue to lose people every single day to coronavirus. To those of you who say the virus is gone, it's not with us anymore, I will just remind you, every day we lose Rhode Islanders to the virus, so it's very much still with us. This 79 new cases is a little bit better. You know, we're doing a little bit better. There were days where we were above 100 a few days in a row, and that's not a good place to be. We haven't had a day over 100 in more than a week. Hospitalizations are pretty steady. New hospitalizations, pretty steady. So we're doing a little bit better, and I want to thank you. You know, our compliance has increased a bit, and you see it in the numbers. You see it in the numbers. So I don't again want to get back to 90 a day, 100 a day. In fact, I'd like to be at less than 79 a day, especially now as we're trying to get ready to send the kids back to school. So I want to thank you, everybody. We've been trying a bit harder. Let's keep it up. Let's try even harder. But you should feel good about yourselves because, you know, this is the result. And 79 is certainly better than 100, and I want to thank you for the extra effort. I want to begin with an update on what we saw this past weekend. We get a lot of questions in the office around what happened on the weekend. It's summer, weekends are busy, people are out, going to the beach. So look, at this time of year, mid-August, you start to see the crowds thin out at the beach anyway. This past weekend, the weather wasn't great, so fortunately, we had a good experience at the beaches. We were out and about, as we always are on the weekends, passing out masks at beaches and at parks. Thank you, thank you, thank you to the hardworking folks at DEM for doing that. We saw good compliance at our parks and our beaches with social distancing, limited crowd sizes, and mask wearing. So I can report that we had a good weekend. Our inspectors visited over 1,000 businesses last week, most businesses we've ever inspected in a period of time. They found 96% of staff and customers wearing masks. That's the highest we've ever seen. So good job, Rhode Island. 96%, over 1,000 businesses were inspected, 96% compliance with mask wearing of customers and employees. Keep it up. That's where we want to be. Keep it up. 98% of businesses were complying with capacity restrictions. So excellent. Thank you. It's what's going to keep us going and allow us to keep the economy open until we have a vaccine. There's one area that we do need to do better. We continue to see it, which is in bar areas in some restaurants as it relates to gatherings. So 15% of the businesses we visited did not have parties socially distanced, so that would be in restaurants or bars. Parties were closer than 6 feet, and 17% of bars still had customers too close to bartenders. So again, it's pretty simple. You shouldn't be operating a bar as a traditional bar. You either have to have the plexiglass up or no bartender behind the bar. 17%, almost 20% of bars still had customers too close to the bartender. You know, at this point, I want to remind you, bars are closed as of 11 o'clock. If we continue to see this 17, 18%, we might have to do more. So I'm asking you to try a little bit harder in the bars, keep the customers away from the bartenders. I will say the 17% is an improvement over last week, so that's good, but we have to do even better. I want to remind everybody, social gathering limits in the state of Rhode Island is 15. I have to say that's probably the most commonly asked question I receive now. Hey, Governor, we're going to be having a special party this weekend. It's my daughter's baby shower. It's so-and-so passed. We're having the family together. Can we do 25? It's just family. No, it's 15. It's 15. You know, I'm having my family over this weekend, and it's just 15. So please follow the law. There are penalties in place. It's a $500 fine per person if you're above 15, even if it's on your back porch. 15 means 15, not 20, 22, 25. We just have to stay strict around that gathering limit. So the good news is we are off the list for New York, New Jersey, and Connecticut. That is good news. We're still not off the list for Massachusetts. We are barely too high for Massachusetts to lift their travel restriction, and I've been in touch with them. Dr. Alexander Scott has been in touch with them. They're staying firm on that rule, and I absolutely respect that. So we have to do better. We have to try a little harder to get our cases down so we can travel more freely between here and Massachusetts. I'm making a point of that because it's hurting a lot of our businesses. You know, I hear from businesses, restaurants, who say, you know, Gov, 20% of my business is from Massachusetts, particularly here in the capital city. I feel for them. They're hurting. They're barely getting by as it is, and now the fact that folks from Massachusetts are reluctant to come here for dinner or go shopping, it's really hurting their business. So if you're asking, what can you do about it? You can follow the rules. Stay home if you're sick, no big social gatherings, wash your hands, wear your mask, and encourage everybody in your family, in your network, to do the same. Keep your network small. It's not a different 15 people every day. It's about the same 15 people. It is heartbreaking to hear from these small businesses that they're barely getting by, and now they've lost a lot of business on account of this Massachusetts travel ban. So let's pull together as Rhode Islanders. Let's get our cases down so folks can get back to work and stay at work. Okay, so for months I've been up here telling you everything you can't do. Now I want to tell you about something you can do and actually encourage you to do something. One thing we know we can do to slow the spread of the virus is to move our life outdoors. And fortunately now, and for the next few months, weather permitting, we can do a lot outside. We know this virus spreads much easier indoors than outdoors. In fact, public health experts say you're as much as 19 times more likely to get the virus indoors compared to outdoors, which is astounding. So for the next few months, while the weather is nice, we want everybody to get outside and do as much as they can outside. So we're kicking off a campaign called the Take It Outside campaign. And it's designed to help everybody move more activities outdoors. We put together a team of folks from the Commerce Department, Department of Business Regulation, Department of Environmental Management, and of course the Department of Health. We have this multi-sector team. They're going to be working with businesses and also cities and towns to help come up with creative ideas to move activities outdoors. And we're going to be putting a little bit of funding behind it as well to, maybe enable more activities outside, heat lamps, certain accommodations to get things outside. So what are we talking about? Encouraging and working with cities and towns to temporarily close more streets and parking lots so we can do more dining outside, more shopping outside. We're going to be encouraging employers to allow folks to have meetings outside. We're going to be doing more to provide mobile hotspots so it's easier to do your work outside. A fitness class outdoors. We're going to be looking at ways to make state property available so you can do more outside on particular properties. I'm going to have a lot more to say about this next week and the week after, but for now, I would say just start thinking about it. You know, if you're a gym owner, think about how you could have exercise classes or yoga classes outside. Think about what you would need from us in order to make that easier or possible. If you own a business, think about what you would need to have meetings outdoors instead of inside, and on and on. But it's a take it outside campaign. We have great results. The other day, Dr. Alexander Scott arranged for a call for the team with some of the leading public health experts around the world, and they really encouraged us to get as many people outside as much as possible. So we're going to be putting our back into that and inviting everyone to get creative. Let's get creative, let's have some fun, and let's figure out what we can do outdoors. Now, I remind you, if you're outside and you can't be 6 feet apart from folks, you do have to wear your mask. The same rules apply, but still we know it is much safer to eat outside, work outside, exercise outside, have a good time. Okay, last week I got a lot of questions about testing, and so I want to spend a few minutes now talking about testing. I want to tell you where we've been, where we are now, and where I want to take us as it relates to testing. We have some tools in our toolkit to deal with this virus, and probably one of the most powerful tools is testing. You know, in an ideal world, which we are not in, if we could, you know, test everybody rapidly with immediate results, that would be the best option. That's not an option available anywhere in America right now. But my point is we want to get close to that, because the more testing we do, rapidly, widely available, accurately, with quick results, the more activity we can resume safely. So we're putting a lot of effort into testing, and I'll be honest, it's been hard. This has been a struggle. Because the whole country, it's a fight for resources nationwide. Every governor's out there. Every commercial lab is overwhelmed. Every university lab is overwhelmed. The volumes are through the roof. And so it has been a challenge. But I want to reassure you, as Rhode Islanders, we are the national leader in testing. So although it's far from perfect, and I'm going to outline some improvements we're making, I want you to feel good about where we are. We've tested more per capita than nearly every other state. We are making tests available for people who are sick and people who are asymptomatic. We have drive-through sites, walk-up sites. We're going right into the high-density communities. And I also want you to know we're constantly changing. Like just recently, we put more testing on the border of Central Falls and Pawtucket. It's a hotspot. We're going to go into the community and do testing in the community. Same thing in Woonsocket, same thing throughout the states. We're constantly changing to go where people are. So where are we right now? We've run just about 440,000 tests, which I think is amazing, considering that 6 months ago, none of us even knew what these tests were, and now we've run almost 500,000 tests. We've tested more than 234,000 Rhode Islanders, which puts us right at the head of the pack nationwide. Our percent positive rate has been consistently below 3% since we started phase 3. That's excellent. Just as a reminder, you know, Dr. Fauci last week says 5%, you want to be below 5%. We're consistently below 3%. And we're testing very aggressively. So I want to remind you the way we're thinking of testing. We have what we call this SOS strategy. The first S stands for symptomatic. It's our goal to ensure the goal, the vision, what we're driving for is if you get sick, we would love to be able to have you tested within 24 hours. We want everyone who feels sick to be tested. We're not quite there, and I don't know if we'll be able to get to that, but we are within 2 days. If you feel sick, you should be able to get a test within 2 days of when you call your doctor, and then get the results back within another 2 to 3 days. The test turnaround time has been an area that we have struggled in the past month or month and a half, and I'm going to talk more about that in a minute. The second O stands for outbreak. Anytime there's multiple cases, 2 or more, in a setting, any setting, a workplace, a nursing home, a daycare center, a summer camp, we call that an outbreak, and we respond. I'd give the team an A+ in this regard. They have done a fantastic job. They have been on the scene for every outbreak and able to do quick, rapid testing, quarantining, isolation, shutting down facilities quickly if necessary for a period of time, contact tracing and case investigation. And every outbreak, and there have been many, many, has been kept limited. So the biggest we've had were months ago at food processing plants. I think there's about 100 cases. But beyond that, that maybe we'll get 2, 5, 10 cases, and we react quickly, and we've been able to put a lid on it. In the case of a couple daycare centers, we've had to close them temporarily. But you should have confidence that the systems we set up to deal with an outbreak are working incredibly well. We had numerous outbreaks in nursing homes, obviously, places of work, manufacturing operations, restaurants, social clubs, and the team is there testing, and that's really working very well. And by the way, you can see the results. We haven't seen nothing. Many states are struggling in their prison system, for example, or in nursing homes. You see the virus running rampant. That has not happened here, and that's because of the hard work of the team. The final S stands for surveillance testing, which is our early warning system where we're testing as many asymptomatic individuals as possible. So to give you a feel for that, last month alone, July, we ran 45,000 tests in congregate care settings. So that would be nursing homes, group homes, prison setting. That's a lot of tests for a little state. 45,000 tests in those group communal living settings. Because of that system, we've been able to significantly bring down the rate of infection in our nursing homes. So just to put a number on it for you, in early May, nursing homes represented about 20% of all of our cases in Rhode Island. In the first 2 weeks of August, they made up less than 5%. That's a stunning improvement. Thank you to the folks in nursing homes. Thank you to the support teams, National Guard and others who've been going out to the nursing homes. Thank you all. 20% to 5% in a few months. And we've also launched our asymptomatic testing program to test high contact workers and younger folks. And I would encourage you to take advantage of that. If you're in your 20s, go ahead and get tested. If you work at a restaurant, you're a hairdresser, nail salon, member of the clergy, don't feel sick, please go get tested. Now the question I get a lot is, okay, Gov, that sounds good. How do I get tested? How do I do it? It's a lot of different options, so I want to try to simplify it. And we've developed a one-page, and I'd ask you to please put that one-pager up on the screen. So if you wake up tomorrow and you feel sick, you have a cough, fever, chills, headache, sore throat, I want you to stay home. Do not leave your house. I want you to call your doctor. Pick up the phone and call your doctor. If you call your doctor and say, I have a fever, I have the chills, I have a headache, I'm coughing, I want to get tested, your doctor can schedule you a test using the system we've set up, and you should be able to, like I said, we'd like you to be able to get a test that day or the next day, but everyone ought to be able to get a test in 2 days. If you don't have a doctor, or you don't have health insurance, or you're an undocumented immigrant, you could call your community health clinic or a respiratory clinic. They are both free and will provide you with free testing. If you're not sure where there's a respiratory clinic or a community health clinic, you can go to health.ri.gov, and there's a whole list of free community health clinics. So that's if you feel sick. And it's our pledge to get you a test within 2 days from when you call, and then results within 2 to 3 days from when you get tested. And the whole while, until you get your results, we need you to stay at home. Now, if you don't have symptoms, but you want to get tested, you need to go to portal.ri.gov, and that's on the paper, the screen in front of you. So this is who this applies to. Let's say you want to go to the Cape for vacation and you want to get a test. Portal.ri.gov. You work in a restaurant, you're a close in contact worker, you just want to get tested, your employer wants you to get tested. Portal.ri.gov. In the past couple of weeks, it might take you a few days to get that test set up. It's better now, and it's going to continue to get better. Candidly, when we showed up overnight on the travel list for 4 states, we were immediately overrun with people who wanted to get tested. So I'm sorry if it took a few days before you could even get an appointment. It is definitely better now. You ought to be able to get an appointment within a couple of days, and then results within 2 to 3 days. I do want to remind you that there's a full list of the 34 states with a percent positive rate above 5% on the Department of Health's website, and anyone returning from these states to Rhode Island has to get tested or quarantined for 14 days. This is a big deal. This is very important. We're seeing a number of our positive cases related to travel. So if you're traveling, if you're a Rhode Islander who's traveling, or if you're coming back to Rhode Island from one of these 34 states, you must get tested or quarantined for 14 days. So getting tested is one thing. Waiting for the results is another thing, and it can be stressful, and I understand that. So let me tell you about where we are and where we're going and why I'm hopeful it's going to continue to get better. 2 weeks ago, I announced that we have just signed contracts with 2 new labs, AccuReference and Dominion Diagnostics. Dominion is right here in Rhode Island. The contracts with these 2 labs are majorly expanding our testing capacity, and both of these contracts guarantee to us results within 48 hours. As of right now, we are, and this is a new thing this week, we're running more than 2,000 tests a day with those 2 new contracts with turnaround times of 48 hours or less. So this is big, and that's what we're doing, yesterday. 2,000 tests, brand new capacity, guaranteed turnaround, 48 hours, and they are going to ramp up as they work out the kinks. We already are seeing a difference. A month ago, our average turnaround time for a test was 5 days. Today, it's just under 2.5 days. So what does that mean? That means a month ago, If the average was 5 days, you could have been waiting a week or more to get your test result. That's not okay, and I'm sorry if that happened to you. That is not okay. So that's why and we're done with that. That was then, this is now. Today, the average is 2.5 days. And we are going to work like crazy to get it under 2 days. As frustrating as it is for when you're waiting for your result, we need you please to stay at home, which is why we're working hard to get it below 2 days. The numbers are definitely improving, and Dominion alone is going to be able to run 7,000 tests a day in a few weeks from now with the guaranteed 48-hour turnaround. So I think I can safely say the worst is behind us. We're much better now on test turnaround time than we were a month ago, and a month from now I expect us to be even better. Although there's been a year of surprises, so we're going to work for that and hope that that comes true. I want to take a second to talk about rapid testing. The tests that take the 48 hours are generally more reliable, accurate than the true rapid test. Having said that, experts will tell you, and our own testing task force will tell you, there's still a lot of value in the rapid tests because they quickly identify positives who we can put into isolation. As a result, we are continuing to use our rapid test machines, and we're continuing to buy more rapid test machines, but we are deploying them strategically. So what does that mean? In hospitals, at outbreaks, in nursing homes, when we open school next month, in school, they get immediate results, which is the appropriate thing to do in certain settings. Right now, in total, we have 10 of these rapid machines deployed all across the state. And we've recently purchased an additional 5 machines, which will give us the capacity to run 1,000 rapid tests a day. That will be devoted to K through 12 public schools so that we can give parents and teachers and students the peace of mind of knowing they can get immediately tested with immediate test results so kids or teachers could be immediately isolated. So to wrap it all up, if you feel sick, call your doctor. You should be able to get your test scheduled within a couple of days and results within 2 to 3 days after that. The whole time you're waiting, please stay at home. Or if you're very sick, go to the hospital. The rapid tests, we are, the turnaround, quick turnaround, 10, 15-minute turnaround, we are using those in specific settings, particularly schools when they open, or nursing homes or hospitals. So you shouldn't expect to be able to get that rapid turnaround test. And if you don't feel sick, but you want to get a test because you want to travel, or you're a young person, or you're in a close contact business, go to portal.ri.gov, and we're going to do our very best to make sure you can get an appointment within 2 to 3 days. Again, a week or two ago, it was taking 4 days. We got crushed all at once with the 4 states, but we're in a pretty good place now. So that means if you know now that you have a Nantucket vacation in a couple of weeks, plan accordingly, because it could take a couple days or a few days to go ahead and get an appointment and then your results. Okay, so that's testing. I feel that we are, I spend time talking to every governor I can, federal government. We're doing about as well as we can be doing. I can't find anyone who's doing a better job, and we're constantly on it, every day, trying to get better. And we will continue to do that to bring down the times. Okay, I want to spend a couple minutes talking about schools. Every Wednesday, I talk a little bit about schools. Last week, I was pleased to be joined by Dr. Anthony Fauci on Thursday on the live Facebook session, and he said something that really stuck with me and that kind of defines our approach. He said that our position, everyone's position, should be that we all try to the best of our ability to get kids back in school. I think that's well said. We all need to try to the best of our ability, push ourselves as much as possible to get as many kids back in school as possible. That is our philosophy. I am not saying it's going to be easy. I am not saying it's going to be perfect. I'm not saying every kid is going to be able to or want to go to school. I'm saying I have learned over the past 6 months that we are capable of doing great things. We're capable of doing great things when we need to, when we rise to the challenge and meet the moment. We put up a field hospital in a couple of weeks. We have set up an entire testing system that's best in class. We have hundreds of people doing best-in-class contact tracing. We didn't even know what that was 6 months ago. At least I didn't. You did. So I think we can do this for our kids, too. And I just am saying, we are not going to force any teacher to work in a building that isn't safe. We care about you. We're not going to do that. But what we are going to do, as a moral obligation to these children, work as hard as we can and push ourselves to the limit to do all we can to get as many students in school as possible. That is my pledge to the people of Rhode Island, and I believe that that's the right approach. And that's why we push back the start time. There's a lot of work to do. We're not ready today. We're not going to be ready by the 31st. But we're going to work like crazy over the next month to do our best. So today, I want to talk for a minute about supplies for school districts, and also talk for a minute about preventing outbreaks. We hear a lot, I spend a lot of time listening to teachers who are anxious, and I hear that. I hear you. We see you. It's valid. We want to work to make it safe for you. The districts are taking the lead. Each school district has to take the lead on procuring the cleaning supplies, masks, face shields, gowns, gloves, thermometers that will be necessary to safely open school. Having said that, I want to reassure everybody that no one's going to be left in the lurch. The state is absolutely at the ready to do our part to help to provide supplies where there aren't enough, or where cities and towns, for whatever reason, can't get the supplies. So what am I talking about? This week, for example, the state is distributing 3,000 thermometers, 600,000 masks, and 10,000 gowns to districts. And that's just this week. We're going to continue to closely coordinate with school leaders throughout the entire year to make sure there's never a shortage. So in the first instance, the school district, that's their job, and they're doing it, and they're working hard and being resourceful, but we got your back. And this is what we're sending out this week, and we will continue to send out supplies as necessary. Outbreaks. I have been asked a lot around what it would take to consider imposing restrictions on schools after they've opened. So as we've said, on the week of August 31st, we're going to make a decision based upon where that school district is and the cases in the community, whether they'll be full in-person, partial, or fully at home. But once we get going, there are going to be cases. There are going to be children that get the COVID virus. There are going to be professionals who work in the building that will test positive. And so after the schools reopen, we need to have a procedure in place to decide what steps we have to take based upon what's happening in the school. And I'd ask you please to put a slide up which explains how we're going to think about it. So the slide that's in front of you on your TV screen shows 3 different scenarios. Scenario 1, the light blue slide on the left, That's where we want to be. So there's a very limited number of cases. They're contained within a stable pod, or they're not connected by transmission within a school. I want to be very clear. That is going to happen, and that's exactly what our systems are designed to handle. That's exactly what the system's designed to handle. We expect to see that. We're ready for it. We're ready to contain it. We're ready to do testing. We're ready to isolate and quarantine the direct contacts. By the way, I get asked a lot, what exactly is a close contact in the school setting? It's the same as everywhere. It's defined as being within 6 feet for more than 15 minutes. So if you're working very closely with a student for more than 15 minutes, or you're bunched up together for more than 15 minutes, that's a close contact, and you would have to be quarantined. In scenario 2, which is the middle path that you see, we have cases in multiple stable groups, but linked by a clear, common school-associated activity. So again, this is exactly what we're expecting and exactly what we know how to handle. We would isolate the cases and quarantine the contacts. In that instance, we would also bring in a team from the Department of Health to consider whether it's necessary to take further action, maybe moving to a partial model or a hybrid model, for example. Finally, in scenario 3, that would be the most serious, that's where we would be seeing what we think of as community transmission that has impacted multiple people across multiple school groups without a clear connection. In that instance, in addition to the immediate steps of isolation and quarantine, the Department of Health would come in and very likely would consider much more aggressive action, including temporary closure of the entire school. So a quick, swift move to 100% distance learning. In every situation, we're prepared to have a team at the Department of Health work with each district on a case-by-case basis. And as a reminder, last week we put out a 24-page health protocol playbook designed to help walk you through exactly these scenarios. That playbook is online at the Back to School RI website, and it outlines the steps that we'll take in every scenario. So in a second, Dr. Alexander Scott is going to go through this in detail, but for the moment, I just want you to know this. We are going to have teams, we're adding to the staff now, we're going to have Department of Health teams at the ready to parachute into schools when, if, and as necessary, to guide the decisions around what happens when we have cases. And a huge amount of thought has gone into these 3 scenarios. We're not alone in this. Dozens of countries around the world have sent their kids back to school already. Every state is muddling through this together. Dr. Alexander Scott has her colleagues. A lot of thought's gone into this, and we are prepared. We are prepared to send teams in to make these swift judgments. Okay, finally, I just want to make a quick note about mental health. It's something I've been talking about a lot during the pandemic. Everybody's struggling. Everybody's struggling. And you add to that isolation, financial struggles, drinking, depression, really hard time right now for adults, but also for kids. And being out of school for 6 months is making it even harder for kids. We're seeing it. Ask any mental health professional, pediatrician, parent. Kids are struggling. And so tomorrow, I want to invite you to join the weekly Facebook Live chat. It's at 3 o'clock tomorrow. I'll be joined by Dr. Jennifer Jenks and Barbara Austin, licensed social workers and children's mental health experts at Bradley Hospital. So I would encourage you to tune in. I think it'll be a good discussion, and I hope they give us some answers to our questions.